From NIHSeniorHealth.gov. Built with you in mind.
This video addresses the following questions. Does dying have to be painful? What are effective ways to handle pain at the end of life? What if pain is not well controlled or returns before expected? What are some issues around opiate use? Will opiates hasten death?
Dying does not have to be painful. Experts believe that care for someone at the end of life should focus on treating pain without worrying about addiction. Research is also showing that pain is easier to prevent than relieve and needs to be treated early and consistently. Patients should not be afraid to take, nor should caregivers be afraid to provide, pain medicine as prescribed. When serious pain is not relieved by acetaminophen, also known as Tylenol, or ibuprofen, also known as Advil or Motrin, an opiate such as morphine, hydrocodone, or oxycodone may be prescribed. Acetaminophen or ibuprofen may still be given along with an opiate to treat the underlying causes of a patient's pain, such as inflammation. Severe pain can require around-the-clock dosing, which provides regularly scheduled doses of opioids day and night. Once pain is under control and the dose of opiate has been the same for several days, it may be possible to lower the dose gradually without the pain coming back. If the pain is not well controlled with around-the-clock dosing, there is no need to wait until it becomes unbearable. Untreated or poorly controlled pain can become hard to manage, causing unnecessary suffering. One should not be afraid to ask the healthcare provider to increase the around-the-clock dose if the pain does not go away, or if it comes back. Sometimes pain is episodic, meaning it returns before the next dose can be provided, or as a result of an event, such as being moved. If this happens, it is important to ask the care provider for breakthrough or rescue dosing. This is a dose of opiate given in addition to the patient's usual dosing schedule. There are many misconceptions about opiates, including the fear they will cause unpleasant side effects or addiction. People can become tolerant of opiates and may require higher doses over time to manage their pain. But tolerance is not the same thing as addiction. And while all opiates can cause side effects, as the person's body adjusts, most side effects will decrease or go away completely. Those side effects that remain are usually easy to manage, such as taking laxatives for constipation. Some people worry that opiates will hasten death. Most experts think this is unlikely, especially if the dosing is managed carefully by a hospice or pain specialist. In fact, research has shown that when pain is well controlled with appropriate medications, people may live longer than those with the exact same condition whose pain is not well controlled. These are just a few of the issues about opiate use. Our module addresses others as well.
Dying does not have to be painful. Remember these points for effective pain control at the end of life. Treat pain early and consistently. Opiates may be prescribed if pain does not respond to acetaminophen or ibuprofen. Sometimes, dosages may be lowered without pain returning. Don't wait until pain becomes unbearable to ask for medication. Consider breakthrough or rescue dosing to control pain that recurs before it's time for more medication. Experts believe carefully managed opiate use is unlikely to hasten death. To learn more, check out the end-of-life module at www.nihseniorhealth.gov.